Dear friends, welcome to our channel. The topic of today's issue: blood thinning. I am often asked a question about how to thin the blood, but if possible without drugs. But first, 2 words about why we need to do it in the first place. Blood thinning is primarily for the elderly, as a means of preventing blood clots, as a means of combating atherosclerosis, and to prevent thrombophlebitis. Usually doctors recommend taking aspirin preparations to thin the blood. There are a lot of these drugs, and you have to realize that, in principle, they're not bad drugs. But I'm not the biggest proponent of this kind of treatment, because these drugs, if you take them over a long period of time, over a number of years, and a lot of people do, these drugs irritate the stomach wall, and when you take them, can cause various problems with the gastrointestinal tract, up to the development of gastritis or ulcer. That is, in principle, take these drugs for blood thinning can and should. But it is necessary to remember about these side effects of drugs. And I recommend my patients, if I prescribe these drugs, to take them in intermittent courses. That is, you take aspirin for, say, 3 months. Be sure to look at the state of the stomach, whether there are any side symptoms. After taking it for 3 months, it is advisable to take a break for 3 or even 5 or 6 months. But what to do if we do not want to take these drugs for some reason? How to achieve blood thinning? You'd be surprised, but it's not very difficult to do. And I'm going to give you some ways to thin your blood without drugs. Method 1. It is very simple. Usually blood clotting occurs in many people on the background of the fact that they drink very little water. So, if we want to be successful in the fight against blood clotting, we need to make it a rule to drink 1 liter, 1.5 liters of water a day. Of course, not 3 to 4 liters of water, as recommended on the internet some hotheads. But you should drink 1.5 liters of water. This 1.5 liters should include water. That is, neither tea, nor coffee, nor juices are counted here. It's just water. That said, the easiest thing you can do is start your morning with water. Get up, drink a glass of water. You can even do it on an empty stomach. But do not drink cold water, but slightly warm or room temperature. And how do you even know whether you drink enough water or not? To do this, strangely enough, is not difficult. If you take a normal clinical blood test, you'll see in that blood test, it's called hematocrit. Now, if your hematocrit is elevated, it's probably an indication that you're not drinking enough water, and you need to increase your water intake. The second way. You need to reduce your coffee intake, if you drink 5 or 6 cups of coffee a day. And you need to reduce your alcohol intake, especially beer in the first place. You also need to reduce your salt intake. Well, people who like salty things, they will take offense at me now. But still, if we want to fight blood clotting, we have to try to limit ourselves to 5 grams of salt a day. And of course, we have to eliminate various salty, preservative-laden foods, smoked meats, particularly smoked meats. That is, remove those products that contain hidden salt. If possible, it is necessary to organize your life in such a way that you move more, take more walks, do some quiet sports. That is, to fight tissue hypoxia. Because it is tissue hypoxia often leads to blood clotting. Let's move on to the next point. Actually, in terms of foods or plants that are used to thin the blood, there are a lot of myths. And a person who consults the internet runs the risk of getting very confused. In the various tables or recipes that are posted on the internet, they often lump together herbs that thicken the blood, and those herbs that thin the blood. And people can start taking medications that not only have no positive effect, but also cause blood clotting. Here we need to be very careful. There are actually 2 plants with a scientifically proven very strong blood thinning effect. It's blackthorn and white willow bark. And they're used in decoctions and infusions. These herbs are very powerful, very effective, but you need to know that, first of all, they should never be taken with other blood thinners. And secondly, these herbs also have significant contraindications. And they too can have an effect on the stomach and on the gastrointestinal tract. Therefore, they should be used with caution in gastritis, ulcer. And in general study the contraindications before using them. We have studied contraindications, choza tuftgrass or white willow bark. The course of treatment with these herbs, on average, 3 to 4 weeks. This course can then be repeated after 3 to 4 months. In addition, you can add to your diet such useful foods or plants, such as, first of all, garlic, secondly, dill, celery and parsley. Many people recommend the use of cranberries. And indeed this product can be useful. But if you eat cranberries a lot and often, or drink cranberry juice, don't forget to drink plenty of water. As we said at the beginning of the program, it's 1.5 liters of water per day. Next, you should know that blood clotting is caused by taking many drugs. First of all, these are diuretics. These are many of the hormonal drugs. So if you have an elevated hematocrit, which is a sign of blood clotting, do an inspection of the medications that you've been taking for months or years. If you find out from the drug label that these drugs cause blood clotting, you need to see your doctor and get some other medication instead. Smokers need to know that smoking, if you smoke a pack or 2 packs of cigarettes a day, also causes blood clotting. So if possible, if you don't stop smoking altogether, at least reduce the number of cigarettes you smoke. You should know that diabetes, especially type 2 diabetes, also leads to blood clotting. So we do both treatment and prevention of diabetes, reduce the amount of sugar and carbohydrates in our diet. One last thing. Few people know that stress and nervous tension lead to blood clotting. So if you're under stress, if you're having trouble at work or at home, it might make sense to take a mild sedative. And that's all for today, dear friends. Stay tuned, subscribe to our channel and be healthy. All the best.